COVID-19, You Can't Cheat a Pandemic, by Jonathan Smith. Biography. Jonathan Smith is a lecturer in epidemiology of microbial diseases and global health at Yale University School of Public Health. His research focuses on infectious disease transmission dynamics, with a focus on TB and HIV among minors and migrants in sub-Saharan Africa. He is an affiliate of the Yale Global Health Leadership Institute and founding director of Visual Epidemiology, a non-profit organization seeking to combine academic discourse with personal narratives through filmmaking. Jonathan Smith originally wrote the piece as a letter to his local neighborhood of about 50 families. It struck a chord, and his neighbors began sharing it widely within their own networks. Shortly after, and many tens of thousands of email forwards later, it went viral. Though it was written in April 2020, the message remains the same. And in my own personal experience, it can be a useful tool in reinforcing the importance of social distancing to loved ones who have grown wary of the strict guidelines. I hope you'll find it as resonant as we and millions of others did.
As an infectious disease epidemiologist, I feel morally obligated to provide information on what we are seeing from a transmission dynamic perspective and how it applies to the social distancing measures. Like any good scientist, I have noticed two things that are either not well articulated or not present in the literature of online media. I have also relied on other infectious disease epidemiologists for peer review of this piece. First, we are in the very infancy of this epidemic's trajectory. That means that even with these measures in place, we will see cases and deaths continue to rise globally, nationally, and in our own communities. This may lead some to think that the social distancing measures are not working. They are. They may feel futile. They aren't. You will feel discouraged. You shouldn't. This is normal in chaos. This is the normal epidemic trajectory. Stay calm. The enemy we are facing is very good at what it does. We are not failing. We need everyone to hold the line as the epidemic inevitably gets worse. This is not an opinion. This is the unforgiving math of epidemics for which I and my colleagues have dedicated our lives to understanding with great nuance. And this disease is no exception. Stay strong and in solidarity, knowing that what you are doing is saving lives, even as people continue getting sick and dying. Second, although social distancing measures have been at least temporarily well received, there is an obvious but overlooked phenomenon when considering groups, that is, households, in transmission dynamics. While social distancing decreases contact with members of society, it, of course, increases contact within a group, that is, family. This small and obvious fact has surprisingly profound implications on disease transmission dynamics. The basic mechanics of this mathematical principle dictate that even if there is a little bit of additional connection between groups, i.e. social dinners, playdates, unnecessary trips to the store, the epidemic likely won't be much different than if there was no measure in place. The same underlying fundamentals of disease transmission apply, and the result is that the community is left with all of the social and economic disruption but very little public health benefit. You should perceive your entire family to function as a single individual unit. If one person puts themselves at risk, everyone in the unit is at risk. Seemingly small social chains get large and complex with alarming speed. If your son visits his girlfriend, and you later sneak over for coffee with a neighbor, your neighbor is now connected to the infected office worker that your son's girlfriend's mother shook hands with. This sounds silly. It's not. This is not a joke or hypothetical. We as epidemiologists see it borne out in the data time and time again. Conversely, any break in that chain breaks disease transmission along that chain. In contrast to hand washing and other personal measures, social distancing measures are not about individuals. They are about society working in unison. These measures also require sustained action before results are evident. It is hard even for me to conceptualize how on a population level one quick little get-together can undermine the entire framework of a public health intervention. But it can. I promise you it can. I promise. I promise. I promise. You can't cheat it. People are already itching to cheat on the social distancing precautions. Just a little. A short playdate. A quick haircut. or picking up a needless item from the store. From a transmission dynamics standpoint, this very quickly recreates a highly connected social network that undermines much of the good work our communities have done thus far. This outbreak will not be overcome in one grand, sweeping gesture, but rather by the collection of individual choices we make in the coming months. This virus is unforgiving to unwise choices. As this epidemic continues, it will be easy to be drawn to the idea that what we are doing isn't working, and we may feel compelled to cheat with unnecessary breaches of social distancing measures. By knowing what to expect, and knowing the critical importance of maintaining these measures, my hope is to encourage continued community spirit and strategizing to persevere in this time of uncertainty.
What should I do if I think I have been exposed? If you are sick with COVID-19 or think you might have it, follow Ministry of Health recommendations, including the steps below, to help protect other people in your home, workplace, and community. Stay home to prevent spread. Stay in touch with your doctor. Notify your supervisor. Avoid public transportation. Call 811 if you have a medical emergency. Keystone Universal Research Technologies Limited would like to thank you for your business and continued loyalty as our customers during these ever-changing times. We will continue to monitor the situation and give you updates as the need arises. Stay home, stay safe, stay well,